Hi, my name is Alvin Parr and I'm the president of Strategic Choices Financial. For the next few minutes, I want to talk to you about group health plans. As we work with different companies and HR professionals throughout Southern California, we keep on hearing the same problem over and over, and you're probably experiencing the same. That is, every year your health insurance carrier prices go up, and you're spending time, frustration, either thinking about whether switching plans or staying with the plans and dealing with that price increase. Well, we have a potential solution. But that problem that I mentioned is coming from the single carrier model. That's the old model of picking one health insurance plan for all of your employees, and then having to realize if you have to switch, you have to do new paperwork. Some employees are going to have to change doctors, and a lot of employees are going to be upset now that they're switching all over. That is the old model, and we want to present a new model that you're going to be very excited about. We are excited about recommending to all of our employees and employer groups, and once they find out about this model, they're switching. 7 out of 10 companies are switching immediately once they really fully understand the power of the exchange. Obamacare, Cover California, has introduced the exchange, which means it's an umbrella of different carriers. So now individuals who sign up for health insurance have carriers to choose from. We want to introduce that same exchange concept to you and your business. And we want to talk to you about CaliforniaChoice. It's a private exchange. It is not owned by California or the federal government. It's a private exchange. It's actually been around for 20 years. Many companies have signed up. But this year, January 1st, 2015, I'm excited to announce that their prices dropped pretty much the same as these carriers. So if you currently have Aetna, Anthem, HealthNet, Kaiser, or United as an individual carrier for all of your employees, it makes total sense to switch to CaliforniaChoice today, because we provide pretty much the same price as all of these carriers, but now you have all 5 in one plan and one bill, including voluntary benefits. That's now solving the problem for you, because now you don't have to worry about switching plans and upsetting your employees and denying your employees a PPO or an HMO. You have it all in one plan. Let's go quickly into what CaliforniaChoice offers, and I think you're going to be very excited about that. First and foremost, they have multiple HMOs, EPOs, PPOs, and health savings accounts. They have voluntary benefits. They have tiered choices as well, which I'm going to go over. But quickly, here are just a bunch of the companies they represent that they've already collaborated, who are providing voluntary benefits. They've gotten the best prices for their companies as well. So yeah, no matter what size your company is, they have all these additional benefits, which I'm going to go over quickly. And again, these are a business solution for you. Instead of just being a single health carrier for you, CaliforniaChoice is a business solution for your health and voluntary benefit needs and more, which we'll go over. So here's what CaliforniaChoice does that I bet your current carrier does not do. They offer free, and let me emphasize, free discount dental, vision, and hearing aid services. That is free, but if you want to upgrade and provide an HMO or PPO dental service, you can also upgrade, and your employees can pay for that, or you can pay for that for your employees. So you have choice right there, and and again, the discount programs are free. Now for HR staff, you have a 24-hour online library of legal resources, including an employee handbook and other resources available to you, so you don't have to be hiring an attorney or having people review your documents. It's all here, up to date, ready for you to go. A very important thing where a lot of companies fall, I guess they make mistakes on, is COBRA filing. As you know, when your employee leaves your company, you got to track them for COBRA. Well, CaliforniaChoice does this for you at no additional cost for state and federal compliance. Powerful benefit, again, available with CaliforniaChoice. Here's something that your employees are going to be excited about, and you're going to look like the hero because you brought it to them. Cal Perks is what CaliforniaChoice offers to all of its members, and this includes discounts to movie theaters, such as about $8 a person for the entire family, discounts to Disneyland and Magic Mountain, Knott's Berry Farm, and a host of other attractions throughout Southern California. So if you'd like to give some free benefits to your employees, they'll be happy with Cal Perks. So trust me, everywhere we've gone, all the companies that have signed up, they love Cal Perks. Now, one concept I want you to understand, if you haven't switched already, you will switch. because individuals throughout America have switched to the metal tier plan. Bronze, silver, gold, and platinum. Platinum being the most rich of all the health plans. But here, if every company will be switching by the end of this year, what California Choice has done differently, or rather, let me focus on this first. If you could only afford the silver plan, well, that means you're forcing all of your employees into the silver plan. And that might not be good for some employees that have a lot of health issues. So what California Choice has done something different that no other single carrier does is they have tier choice. So again, if your budget is silver, you're able to offer a tiered plan, the next metal up, a gold package, which is richer in benefits to your employees that need it, and they will pay the difference. Let me repeat that. Your budget is still the same, but now you're giving your employees who need it the opportunity to upgrade to a gold plan. If you could afford a gold plan, you're now offering your employees platinum. That is a great opportunity. Step 2, again, we hear this over and over that you're having to switch plans because premiums went up. You define the contribution. Once you're in California Choice, if Kaiser is the best price one year, and next year they go up, but then Aetna is the lowest price, you can switch internally and you don't have to do new paperwork. It's as easy as that. And you're probably thinking, well, is this confusing to my employee to be able to tell them about 5 different plans? No, the worksheet is very easy to understand, and I'm going to show you that worksheet right now. Here's an example of a worksheet. It's a medical office that has 7 employees. They chose the Platinum Gold plan. They're paying 100% of the health insurance, the lowest price plan for all their employees. And in this case, for a 27-year-old female, the company's contribution is $264 because Kaiser, for her location, her age, is the lowest price plan. And they're contributing $264. So here's the wonderful part. Let me show you how easy and simple this worksheet is. Your employee's going to get this, and it's going to show 18 different plans, HMO plans. You got United, Aetna, Anthem, Kaiser, and HealthNet, all in the same plan. So your employee can take a quickly glance and see that which plan makes sense for them so they can keep their doctor, keep their hospital. You're not forcing them to switch over, and they can pick any of them, and if there is an increase in it, they pay the difference. That's how easy it is. You're not going to have any more frustration, angry employees that are saying you forced me to switch doctors, and that does happen. There's a lot of low morale over that. And some of them are just grateful that you're providing the health insurance, but now you're giving them choices here. But here's the other wonderful thing, is that they got, in this case, she has 7 PPOs to choose from now. And it includes HealthNet and Anthem. So if you're not providing HealthNet or Anthem, then you're not providing a PPO. Here you can provide PPOs, and if she, in this case, wanted a PPO, let's say Anthem Blue Cross Gold Plan, she only pays an extra $81 on top of what you're paying, and now she has a PPO, and she can go to any doctor she wants, and thanking you for that, for selecting California Choice. So just to make it also how easy to understand for your employee, let's assume she wants the Aetna, or let's go back, let's see what other plan. How about the number 10, Anthem Blue Cross Gold Plan, extra $57 a month. Then we go on to the next page, page number 3, and we show your employee what that plan looks like. Number 10, it's the Anthem Blue Cross plan. It tells you her exactly what her co-pays are, what her out-of-pocket maximums are, specialist visits, and so forth. It's all there in black and white, easy to understand. She can choose and go home with her husband or her family and choose which plan would make sense for them to, again, keep their doctor, keep their hospital. It's very easy. So I ask you this question, again, you're frustrated or having to switch, dealing with the price increase. Doesn't it make sense to stick with one plan that has all the carriers with the price that's going to make sense for you? Now you don't have to worry about that, and it's going to help you and your employees be happy, healthy, and prosperous, and making sure your business is successful. So we're here to support you in that. If you're interested in a free quote, just give us a call at 626-441-2284, and you're going to be very happy what we have to say about CaliChoice. This could be the last health plan you ever choose, because again, you don't have to be shopping around. It's all there for you with the top best plans for you and all the choices you need: PPO, HMO, HSA, and EPO. Have a wonderful day, and thank you for your time. Bye-bye.